Please always consult with your physicians prior to making any changes to your treatment plan. Music is courtesy of Ryan Hamner. Welcome to Living with Scanxiety, the Cancer Podcast, a podcast geared to help you navigate the pediatric cancer world. As a mother of a child who battled a soft tissue sarcoma for over a year, your host, Rosaria Kozar, understands and will help guide you through your journey. She brings the knowledge of experts, families, survivors, and other organizations tied to the pediatric cancer world to your doorstep. Her mission is to inform, support, and promote hope for you and your family.
This is where hope lives. This is where hope thrives. Together as one, we all have...
People don't, like I mentioned, people don't think about this, but then people with late effects, you have to start advocating for yourself because you're no longer a child.
Hi, it's Rosaria, and we are picking up off of our two-part episode with Juanita Prada, and she is a late-term effect advocate, and you can find that on Behold Be Gold on her Instagram, IGTV, where she has numerous episodes, and they're very, very informative. She is a 2-time survivor of ALL, leukemia, and right now, we are picking up on the point in the episode where she's discussing education and becoming a child life specialist. This means overcoming her own late effects.
Yeah, thank you so much, Rosaria. It really is. I always, like you're saying, I feel like because I survived childhood cancer, it's a duty for me to stop being negative and start being positive. And if you can't do it, you do it again. And if you fail, you go again, because like for me, being a survivor is like, dang, it's like being a freaking survivor, you just got to go out there and you survive the biggest challenges in your life, right? As a child, as an adolescent. And that is no excuse to keep pitying yourself later on through life. So obviously my mentality changed as I got older because that's how we develop, right? So when I was young, when I was in middle school and elementary school, when I was in middle school and high school, I really was like, this really sucks. I'm not in normal classes with my friends. I'm in the special needs classes. This really sucks. Oh, this really sucks. Why do they not have to stay after school and I do? Oh, this really sucks. Why can I play sports and they can? Oh, this really sucks. Why are they having relationships and I'm not? Oh, this really sucks. Why do I have to work, triple my work and not, they don't? Oh, this really sucks. Why do I have to? Why? Then I got into, and then after high school is like, oh, this really sucks. Everybody's going to 4-year colleges and I am going to a community college. I didn't even get into community college because my math skills were so low. So even community college, I was like, what? This really sucks. Unbelievable. All this because of childhood cancer. So after that, what happens after childhood cancer? Well, people don't, like I mentioned, people don't think about this, but then people with late effects, you have to start advocating for yourself because you're no longer a child. And at this moment, when I finished my cancer treatment, my dad, he moved to Colombia. And then it was childhood cancer was so overwhelming that he was like, heck, I gotta get out of here for, I don't know how long, but, I'm just going to go back to Colombia and do my thing. And you're healthy, you're good. You can do you and not doing this out of bye, but just you need to do you. And so what I'm saying is you need somebody, you need a person to advocate for you because you had this illness. So I got resource. My dad got looked up some resources with my school, and they were like, we're going to get you a vocational counselor. And a vocational counselor is somebody who kind of helps you through. For those who are not familiar with it, somebody who kind of helps you when you have a disability or when you're just struggling to find what you're going to do after high school, somebody to help kind of helps you transition into a job, basically. And so then after that, I mean, I then finally got into community college. And then after community college, I was accepted into a 4-year college. And then that's when I go back to, like, I didn't stop, because I was like, heck, you did community college. That was a big hurrah. And now you want to be a child life specialist, Juanita? Well, you're going to have to go to a 4-year college. And so that's what I did. And then at the 4-year college, obviously I struggled. Obviously, I wanted to go to the closest 4-year college near my house, because I'm still not I still felt dependent. And I was with my mom at the moment. I lived with my mom. And I felt like I just couldn't go out and about like everybody else and do my thing, And then after that, yeah. And then that's when I started seeing, like, I need to advocate for myself. And then when I was starting to have that mindset and be positive about it and changing my outlook on life, I then went to Children's National in Washington, D.C. to do what's before a child life internship. It's a child life practicum, which is less hours. And so I was able to get into a child life practicum, and that was like the most glorious thing ever. Just graduating from a 4-year college and going to DC to live for like a few months independently. Those have been very big milestones in my life. And so after my practicum, I then had to start applying to internships, child life internships. But then, bam, I started having seizures. And then I was like, this is not okay. And I started having them very frequently, like all week, like twice a day, 3 times a day. And I was like, I am not liking this. I'm not liking this at all.
So are you considered an epileptic now?
Yes, exactly. So I went to the neurologist. That's the thing with childhood cancer, is like, once you're done with childhood cancer, like you just have your childhood cancer oncologist and nobody else knows your history, right? So they're like, so where did these arise? And I was like, well, I had childhood cancer. And so then that's the thing, like, you have to be your own advocate. You have to tell these doctors, like, look, this just didn't pop out of the nowhere. This has a specific reason. I had a stroke. I had childhood cancer. Something happened to my brain. This part of my brain doesn't work. And so this doctor contacts the other doctor. It's like a chain of doctors and nobody, and so they want to experiment something new. And then you're like, no. So you have to really advocate for yourself. And that's what I did. And they told me, I went to the doctor that told me, like, well, this looks like, from what your history that your pediatric doctor sent us, it looks like this, you have this, and it came back, and we're just going to start giving you medication and etc. And then that's when I was like, really? And then they're like, and you can't drive. Oh my gosh. As soon as they said that, I felt like I was back as a child, back as a childhood cancer patient, back as, like, they took away something that for me is my autonomy, for me is my independence, They took away me, like, as soon as they said you can't drive, I was like, well, like, that's not fair. Again, I was saying, like, all these negative words that came out of my mouth that didn't come out for a long time. And then they came back to my mouth. And this is not fair. Why me? I was just very, very, hysteric. And I was crying, and it was just really one of those moments that I was like, why me? Why does this have to happen to me again? And I'm sorry, I'm getting a little emotional. But it was a feeling that the why me? Sorry.
You can take your time.
And so as soon as they said that, I just felt like this is not fair. And
it's not fair. Okay. It's not fair.
It's not. And so it was just one of those moments that I just felt like this has to stop. And this has to stop, like you can't, like, okay, Juanita, then you have to go back to think, I got home, I sat on the couch, I screamed it out, I cried it out. And okay, maybe for people it's like, well, it's like a driver's, you can't drive for several days. No, that's not the case. The point was that it's like they're telling me another like news I just didn't want to hear, because it changed, like right when I was getting back to normalcy again, right when I was like feeling like all cool, like with my, I'm like going out with my friends, I'm partying with my friends. I'm now, I now graduated from my 4-year college, like my friends. I now, I was like, I wasn't trying, like, I try not to compare myself a lot, but it's hard not to, but just being in that path of life, right? And then obviously now I understand, and it's taken me a while to understand, like everybody's path of life is different, especially if you had childhood cancer. It changes your life dramatically, so many aspects of your life. So I got up from the couch, because I was there sobbing. My boyfriend was comforting me, and he was like, look, it's going to be okay. I'm going to be here for you. Whenever, obviously, he was just being sweet and consoling. He was like, whenever you need a ride, obviously we're going to help you. We're going to, with your mom and your dad and everybody here. No, you're going to be okay. Anyways. And of course, those are words that, like, at the moment it felt like, well, it's not you, so you don't understand. But at the same time, if it let me know, like, I don't know, something in me, that moment, that time, I felt like, again, it's the energy. It's like, okay, Juanita, you're not a pessimist. You need to keep going. You're not going to give these doctors, basically the right to tell you something. And for me, so I was like, just get up, you're going to do something, and you're going to talk about it. You're going to make change and do this and that, So for me, it was like a sensation. And that's how I describe Behold, Be Gold, because it happened to me, but it happens to many individuals who after childhood cancer accomplish many life milestones, even if it's just like having a stroke and then, being able to walk, that's a milestone already. That's huge.
Yeah.
So I, with the Behold, Be Gold community that, I talk to, I interview, and we all talk, and they tell me about their late effects. Every milestone that they have accomplished, I call that Behold, Be Gold moment, because a Behold, Be Gold moment is like, okay, I was sobbing, I was crying, dramatically and everything, but then I got up, and shook it off, and you keep going. You keep going, because that's what you need to do. You just need to go out there and, try your best, do your best, and not let something like completely ruin your days and your weeks and your years, life goes on, right? And if life has to go on with me making some adjustments, making accommodations, making a little bit of extra time, having a little bit of extra time, we can do this, So I got up and I was like, no, Juanita, you're going to keep going and talk about it. I think it's time for you to kind of like investigate. And so then I started investigating. There was really nothing for late effects. I would just I would go Google stuff, but there wasn't a lot of like stuff that popped out to me that I was like, well, and it's not like my doctors didn't tell me about late effects. They told my parents about the late effects that I could possibly had, but nobody after childhood cancer starts like telling you like this, she could have that. She could, no, because you already had the victory moment, and let's just keep it that way. Right. However, I want to know, because this is what my life later on is going to turn out for me and for others. Right. And so I wanted to investigate, and I know that for me, it was a lot of the stuff that happened to my teeth, because that was the chemotherapy I had to get. We're talking about financially, right? There's so many components. Like I had to go to Colombia and it was cheaper over there. So I had to get surgery for my mouth and then for teeth that just didn't grow normally. And so my vision was lost, so I wear contacts now. So it's a lot of things that late affect, and those are my late effects, I can tell you some of the other late effects that others go through. So there's like auditory late effects, there's bladder late effects, there's bone late effects. There's secondary cancers like breast cancer. You're at higher risk. Can I have children? Reproductive late effects, cardiac late effects, cognitive late effects, dental late effects, digestive late effects, endocrine late effects that we just mentioned, hormones, hearing problems, hepatitis, kidney late effects, liver late effects, lung and pulmonary late effects, secondary cancers. Again, I repeated that because that's, just emphasizing that skin cancer, and spinal problems, spleen. I mean, there's vision, there's so many late effects. And these are just, again, these are depending on the age you had cancer. Mm-hmm. These are depending, also, I guess, on many factors. I know it's the age you had cancer, what type of cancer did you had? What kind of treatment did you have? I mean, the factors vary with everything. And so I was just like trying to investigate all this, and I just started, I've been, I guess, after cancer, I was, a teenager and a child, and I didn't like to discuss it with people. I wanted to be normal. So I didn't discuss it with my friends. When I went to high school, I didn't really discuss it with anybody. And I just felt so happy that people were treating me nicely and accepting, and acceptable. And not everybody was nice. Of course, not everybody was successful. And I did get a lot of looks. I did get a lot of stares. I was embarrassed. But at the same time, I can never say I didn't have like a good supportive, like friend and community to help me like with that. And so from there, I just like, afterwards, I ignored cancer and the late effects, but then you get older and then again, this rises up. So now I'm like, well, and I didn't like telling people that I had a learning disability. I was in the special ed class, and those people knew that I was in the special ed class, knew that I had a disability, correct? They didn't know what type of disability I had, but I had a disability. I have a disability. And then it's shameful. It's shameful. It's embarrassing. And then later on, I just had to put all that shame and embarrassment out, because again, I had to think it with a positive attitude. Okay, Juanita, you being in a smaller classroom is going to help you get better grades. Okay, Juanita, you staying after school is going to help you know what's going to be on the test the next day. Okay, Juanita, you not being able to drive at 16 years old, like all your friends, it's okay. That most of them are probably gonna do reckless driving or something. Okay, I'm making a little joke, but you know what I mean. Like, I always try to find like a positive to it. I had to take my driving exam like 10 times because of these late effect cognitive issues, But when I got my driver's license, I was so prepared. I was ready to go. And I told all my friends, I was like, thank you for the million rides you gave me. I can drive now. Peace out. So it was a lot, the cognitive late effects have been a struggle after a struggle. And I just couldn't believe when I got accepted into my 4-year college. I was so in shock. And it was one of those moments that I was like, wow. And to the practicum, the child life practicum, I was like, wow. Like, why? Because I kept saying, you can do this. You can do this. And if you're going to do it, people always tell me, they're like, I don't know who always tells me that. My mom tells me that. She's like, are you going to, I would always call her anxious about an exam or something, like, Mom, I can't do this. I can't memorize this shit. Like, I can't memorize this. I just can't. She's like, oh, Juanita, are you gonna die the next day? I'm like, okay, well, it's an example, right? But she just made me be like, Juanita, like, wake up. Are you gonna die the next day? I'm like, no. So whatever, take it. And if you have to take it again, you will take it again. Just play with it. I'm like, Mom, but you don't understand. Like, I'll have like a bad grade. And she's like, so what? You'll go to summer school. You'll get better. I'm like, so it's always like those positive like things that, I feel like we freak ourselves out too much, and it's normal. It's a normal feeling. But at the same time, that's how I live my life now, because all those comments that are made in my life, right? Just like trying to see the positive out of it, not the negative, positive out of it. And yeah, that's, it's a lot of late effects that, going back to late effects, it's a lot of everything, it influences every aspect of your life, for individuals who I've talked to who have late effects, such as reproductive late effects. And they're like, well, in early menopause, it's like, am I going to be able to have children? Am I not? And that's a lot of like I always tell people, like, it's not, like I just mentioned, it's not fair. It's not fair because we were condemned with this illness at such a young age. And now it's really one of those things that when you say, yeah, we survived, but really it just keeps going. Cancer still remains. If it's not the actual cancer itself, it's the late effects. Like, it's there. It's not, it's something that, okay, relationships. Okay, let's talk about that. How are we going to, tell, thankfully I've been with my partner for 5 years, and I've had to, you have to be careful, like you always have to be careful who you date, right?
Yes.
You always have to also be careful what they're going to think and how, if they're going to be able to put up with all that's going on. Right. So I know that when I met,
that goes for everyone, please. I mean, I had to make sure that I had that too.
Exactly. It's one of those things that you just always have to, you want to be, are you going to be there with me? I would tell him, and I told him this, like maybe our third week of dating. I was like, to not scare him off. I was like, are you going to be there when I have a seizure and I'm going to be dropping on the floor, convulsion? And this is exaggeration, but I'm just saying, like, this could happen, right? Are you going to be there when that happens? Are you going to, and that's a lot of pressure, right? But they have to know what they're getting into, right? They're going to have to know how many medical visits we're going to have to go to in our lifetime, right? They have to know, I don't know, like, the family members who know about you, right? Like, make a connection with the family because they're the ones who know you. They have to know if we're able going to have children in the future, right? Like, they have to know, like, about all these late effects.
And that was actually, I mean, I could speak for myself with epilepsy. That was a huge thing for me. Would I be able to do that? And I was fortunate enough to have 2 children. Not fortunate that one of them had cancer, but I was fortunate enough to carry 2 amazing, beautiful children. But yes, that was a big thing. I had to tell my husband when we were dating, I have to have planned pregnancies and might not be able to have a baby, but guess he loved me enough to stick with me. So
they're always the right people. And it, honestly, like, it's just one of those things that it just makes it a barrier, makes it challenging. And so I describe Behold what came to me as, like I mentioned, the moment was like, Behold, it's Behold is to perceive an unstoppable force of positivity, ambition, and resiliency that arises within you while undergoing the barriers and late effects that come with surviving childhood cancer. What that means is that even though we have barriers, even though we have challenges, even though we have, all these things that come after childhood cancer, we are still maintaining, like, soldiers, right? Like warriors, because we've been through hell already. And after survivorship, I mean, it doesn't mean that we're not going to go through it again, but I'm just saying, or we could, but I'm just saying, like, you've done, at least you were able to take that next step to go back to school, at least you were able to go to, you were able to make that A on your exam or whatever grade it was, at least you were able to just be present, and at least you would be able to be there for that friend for this, or, you were everything. So I think it's more of like a energy, like a vibe, like a mentality, like, despite our late effects, we did this, we're able to do this. And if we are not able, we will find a way. It's more of like an ambitious kind of like vibe, that's where I wanted to get to it. Like, like more awareness for late effects, because there's a lot of struggles after childhood cancer that most people don't know about. Most people don't even, that I talk to, most people don't even know what late effects are, which is okay. That's why Behold Be Gold is here. That's why other childhood cancer late effects pages and resources are here to teach, right?
I think the great thing about your show is that there's a lot of parents out there. Not all caregivers do this, but when their child gets past that 5-year mark, they kind of want to forget about things just as much as you. And they don't necessarily tell their child, this could happen to you, or this could happen to you. And maybe you were so young that you didn't know those things could happen to you. But some of the survivors I've talked about said, I wish my parents told me XYZ, because I would have a totally different perspective than I do now. And I wouldn't be as shocked. But we have to wrap up. I'm so thankful that you were here. I have a couple, we've just reached like the end or interesting / fun part of the show. So let's see if you can handle it. Would you rather read minds or tell the future?
Would I rather read minds or tell the future? Read minds. Okay.
What song best represents your life today?
So it's a Spanish song, but I know you probably have heard of Mark Anthony.
Yes,
Mark Anthony. He's just very famous for his salsa singing music, and he has a song that I've just always put on and I love to hear, and it just I love salsa dancing. So what gets me up all the time is his song. It's called Vivir la Vida. And basically, Vivir mi vida. And so it's a song really about vivir, to live my life. And it's just those who are listening to this, get out there, just Spotify it, Google it, YouTube it. You'll see the spice to it, and it's basically it's
the vibes are good.
A vibe of no matter what I just mentioned, no matter the obstacles, no matter the barriers, live your life dancing and happy, and you just get going.
Yeah,
with positive attitude.
Or you could meet anyone in the whole entire world. Who are you going to meet?
I'm going to say John Mayer, which I don't know why I said that, because I don't know. I just thought of John Mayer, like his music. So
thank you so much for coming on. Everybody check out Behold Be Gold on Instagram. She has really great IGTV videos, and she spends a lot of time when you watch the video. There are a lot of facts that pop up, and you see the side by side of her with her guest, and like she said, she does the late effects and she interviews, and it's amazing. So thank you so much for joining me on the show, and I appreciate your time.
Thank you so much, Rosaria. Thank you for having me.
Thank you for tuning in to Living with Scanxiety. Please subscribe to hear more informative discussions like today's. Music is courtesy of Ryan Hamner.